I am Fabrizio Michelassi. I'm the Louis Adler Stimson Professor of Surgery and Chairman of the Department of Surgery at Weill Cornell Medical College. The Department of Surgery was founded in 1898, the same year that the Medical College of Cornell University was established. I'm honored to be the 10th chair of this department, a position that I've assumed in 2004. And since then, there's been an incredible growth of clinical programs, educational endeavors, and research programs in our department. Many of our full-time faculty members are internationally recognized master surgeons and leaders in their own specialty. We all try to deliver compassionate, humane, state-of-the-art, minimally invasive, and maximally restorative care. We have great expertise in gastrointestinal surgery. As an example, our obesity center was the first one in New York City and New York State to receive full accreditation of Level 1A, American College of Surgeons accreditation for a center of excellence. We're also the first department of surgery in the United States to establish a metabolic surgery service specifically for the surgical treatment of type 2 diabetes. Our colorectal surgeons are renowned internationally. They've been pioneers in developing the field of laparoscopic surgery for colorectal diseases, both benign and malignant. And others have spent their life to figure out ways to save bowel when operating on patients with Crohn's disease, or save patients from a stoma when operating for ulcerative colitis. We also have great expertise in oncologic gastrointestinal surgery, surgery for treatment of rectal cancer, colon cancer, pancreatic cancer, gastric cancer, liver cancer. In liver cancer nowadays, almost the majority of these procedures are done laparoscopically, as well as in colorectal, gastric, and pancreatic cancers. And this is done with the help of our medical oncologists, radiation oncologists, colleagues in a multidisciplinary fashion, with the ability, therefore, to provide the patient the best cure rate, the best palliation, and the best results from a cosmetic and body image. The first kidney transplant in New York City and in the tri-state area was performed in this hospital by our surgeons in 1963. And since then, we've performed close to 4,000 kidney transplants and many pancreas transplants. Our surgeons were also the first in the country to establish a three-way living donor kidney chain for kidney transplantations, and the first in the tri-state area to perform islet cell minimally invasive infusions for the treatment of diabetes type 1. Newly established liver transplant program also is bringing incredible expertise in liver transplantation and in minimally invasive techniques for living donations to this patient population. Our technologically advanced operating rooms provide our surgeons with the most sophisticated 3D imaging and robotic technology. Our vascular and endovascular surgeons take advantage of these facilities while providing the entire spectrum of endovascular and surgical therapies for treatment of patients with arterial and venous diseases. Our formal training programs include a fully accredited general surgery residency program and a residency in oral and maxillofacial surgery. In addition, we have fellowship programs in colorectal surgery, vascular surgery, plastic and reconstructive surgery, minimally invasive surgery, and burn surgery. Our breast surgeons at the Weill Cornell Breast Center are part of a multidisciplinary care team dedicated to the treatment and emotional healing of patients affected by breast cancer. As part of this process, our breast surgeons have introduced many minimally invasive surgical techniques to minimize the physical trauma of surgery and have added oncoplasty techniques to achieve the best cosmetic results for women with breast cancer. Surgeons from our Division of Burns, Critical Care and Trauma have treated close to 40,000 burn patients, including the firefighters and burn victims of 9/11, since the founding of the William Randolph Hearst Burn Center in 1976. Our burn center comprises intensive care and step-down units and 2 hyperbaric chambers for the treatment and rehabilitation of burn patients. In addition, our surgeons deliver care to trauma and critically ill patients as part of NewYork-Presbyterian's Level 1 Trauma Center, the busiest in New York City, and provide state-of-the-art care in our surgical intensive care unit. Our plastic and reconstructive surgeons have broad surgical expertise, including breast reconstruction after mastectomy, abdominal wall reconstruction, and reconstructive surgery of deformities resulting from removal of large tumors. As part of their commitment to provide the best possible care, reconstructive procedures are preceded by evaluation with 3D imaging systems as to best understand the extent of tissue defects and predict the result that can be achieved with surgery. Our Endocrine Surgical Oncology Center brings together multiple specialists in the treatment of thyroid, parathyroid, adrenal tumors, and endocrine tumors of the gastrointestinal tract and pancreas. The Division of Pediatric Surgery is a major referral center for complex and rare disorders in infants, children, and adolescents. We offer expertise in pediatric surgical oncology, thoracic and abdominal surgery, trauma, neonatal anomalies, and single-incision pediatric endosurgery. The Department of Surgery is a major contributor to basic, translational, and clinical research in areas that influence the practice of surgery. We continue to bring scientific discoveries into the patient care arena, improving therapeutics and strategies for treating organ-based conditions.